urging policymakers to urgently collaborate on a national strategy to eliminate neglected tropical diseases following a worrying rise in cases, particularly scabies, across the country. Health officials warn that without targeted policy interventions and sustained public education, the cases will continue to rise, especially among marginalized and low-income communities who remain the most affected. Our Ashanti regional correspondent, Fatih Aminu Ibrahim, has more.
Globally, an estimated 1.7 billion people live with neglected tropical diseases, commonly referred to as NTDs. These diseases predominantly affect people living in poverty, with limited access to clean water, sanitation, and health care. Neglected tropical diseases comprise a group of more than 20 health conditions, including leprosy, river blindness, trachoma, scabies, schistosomiasis, yells, and Buruli ulcer. In Ghana, 14 of these diseases have been identified, largely affecting vulnerable and economically disadvantaged populations. In the Ashanti region, health officials say nearly every district has recorded at least one case of scabies, one of the most prevalent NTDs in the country. Records show that 1,824 cases were reported in 2022. This number rose sharply to 5,430 in 2023, declined to 4,225 in 2024, but surged again to 6,176 cases in the most recent reporting period. While reported cases of other NTDs such as leprosy, yells, schistosomiasis, and lymphatic filariasis remain relatively low compared to scabies, health authorities caution that complacency could undermine national efforts to eliminate these diseases. According to the Ashanti Regional Director of Health Services, failure to act decisively will prolong the suffering of poor and vulnerable populations who bear the greatest burden of NTDs.
The disease affects poor people, and because it affects poor people, they don't even have the voice. It affects the marginalized people, and what this neglected tropical disease will do to them is also that it sinks them into the poverty range, so that it becomes a vicious cycle. And so that's why it's neglected. And it's neglected by who? First of all, it's neglected by the well-to-do. If you look at globally, policymakers and governments also neglect them. And so because of that, there is a need for us to highlight, especially if you have the goal that we have.
Speaking at a news conference to mark World NTD Day, the Ashanti Regional Director of Health Services, Dr. Fred Adumaku-Boateng, called on policymakers to work together to develop a comprehensive policy framework aimed at eliminating neglected tropical diseases in Ghana.
This is still the Channel One newsroom here on Channel One TV.